A functional neurological disorder, or FND, is a brain problem in which there is a medically unexplained issue with the way that the brain receives signals from the rest of the body and sends signals to the rest of the body. A common analogy to describe an FND is like comparing it to a computer hardware and software problem. In FND, there is no hardware problem. The structure of the brain and the spine is intact, but there is a problem with the software or the program that the brain uses to function. FNDs can be broadly categorized into three. Number one is sensory FND, which is where patients can have negative symptoms like loss of sensation, very much like receiving anesthesia at a dental practice, or positive symptoms such as extra sensations like pins and needles or pain. Some patients can have both positive and negative symptoms. Number two is motor FND, which is where patients can have problems with moving the muscles in the limbs or may experience involuntary movements with the muscles, such as tics or tremors. Number three is dissociation seizures, which is where patients have clinical symptoms of a seizure, such as loss of consciousness, but there is no evidence of seizure activity when we measure brain waves with an electroencephalogram or EEG. As there is usually no structural problem with the brain identified on structural MRI or EEG testing, patients with FND have typically been neglected by healthcare professionals, leaving them angry, frustrated, and fatigued with having to explain their problem repeatedly to people. However, early research using a scan known as a functional MRI scan, which measures tiny changes in blood flow around the brain, suggests that there may be a problem in the way that different parts of the brain can connect with each other. This work is still in its early stages, and functional MRI is not used in the diagnosis of FND at present. The precise cause of FND is not yet known, but the view that it's an entirely psychological problem is completely wrong and outdated. Indeed, psychological factors may play a role in some patients' FND, but in others it may not. This genuine and disabling problem is likely caused by a cluster of different things, such as physical trauma, viral infections, and difficulties with the way that the brain processes emotions. The diagnosis of FND depends on the type of FND a patient has. Clinical tests such as Hoover's test or the tremor entrainment test may be helpful. In other cases, patients may undergo an EEG or a structural MRI. Some patients can benefit from physical therapy to relieve limb weakness. Others may benefit from a speech and language therapist, others an occupational therapist, and there's also a role for cognitive behavioral therapy.